Hi, everybody. Welcome to the Caregiver Education and Training today. I'm going to go ahead and share my screen. This is going to be part 2 of the Caregiver Health and Wellness. So I will quickly run through what I talked about last time. And just to summarize what I went over. So being well throughout your caregiver journey. My name is Amy Blackburn. I'm the program manager in the Family Caregiver Support Program at St. Barnabas. So basically I went over optimum or optimal aging and where does the decline start during the aging process. It can start as early as our 20s, 30s, 40s. And then breaking down just the definitions, the differences between optimum or optimal and successful aging. And then as a family caregiver, how can you achieve the most favorable conditions during the aging process? Because as a family caregiver, a lot of times the focus is on your loved one and you kind of lose focus on yourself. So you want to have as much of a balance as possible. And so here's the slide again on where the decline starts. And some of the factors we have to consider during the aging process is acute and chronic conditions that come up that can be preventable, some of them, and some of them not preventable. So that optimum aging is kind of achieved when you keep those things in mind. I went over the normal aging changes, which are universal, inevitable, and irreversible. So these things we can't stop. Biggest thing is probably our central nervous system being affected, decreased functioning in the central nervous system. And that's the communication between the brain and the nervous system, how our muscles function and respond. It's really all of our functions in our body. So the functioning just kind of slows down and not as responsive as our younger years. So these are just some of the common chronic and acute conditions or things that can happen in our 20s, 30s, 40s. A lot of the chronic conditions that we deal with in our lives that affect us when we're older really begin in our 40s and in our 50s. So it's good to monitor those things and manage them and add those healthy lifestyle factors so that these things aren't exacerbated. So the thing that makes getting older difficult is the accumulation and interaction of those acute and chronic conditions in each decade as we age. And factors that can improve the situation and also make it worse are like lifestyle choices and the art environment. So the best result we can attain regardless of current conditions. It's a little better whole than success aging. Success aging is kind of reached a certain level where everybody's kind of level is different. Everybody's best is different. So I just kind of reviewed how we can cope with accumulations and prevent managing those chronic conditions, stop acute conditions from becoming chronic, and those healthy positive lifestyle choices. And then
Hi, Olga.
The unhealthy
Hi,
choices.
Olga.
Hi, who's that?
This is Anna.
Hi, Anna. Can you go ahead and mute yourself for now?
I went to doctor's trash, you know.
Anna.
Yes.
Anna, can you hear me?
Yes.
Can you go ahead and mute yourself for now?
Yeah.
Okay, and then if you have a question or a comment, you can type it in the chat box, and then I'll break every so often for questions.
Well, I don't know how to do that.
To mute, I'll mute you. There you go. Just keep that in mind. You're muted, so if you have a question or comment, you can type it in the chat box. All right. Is there anybody else in the room? Okay. So coping with those accumulations and aging, adding positive health lifestyle choices and raising healthy ones. and then changing your environment if needed. Okay, so this is where we broke last time. So that was just basically what we talked about before. Okay. So we're just going to go through different scenarios. As I mentioned, the accumulation and interaction. Yeah, Olga?
Oh, I was gonna say you keep breaking up, like keeps going in and out.
Okay, that might be on your end too. Michelle, is it breaking up on your end? It is? Cynthia?
Yeah, you're like sticking and skipping. Can't hear you very well.
Yeah. Okay. That might be my connection. Well, hopefully this next part we can get a good reception. All right. So in this first scenario, this is an example of when normal aging changes interact with an acute occurrence. So a normal aging change is the decreased muscle mass, or that decrease in lean body mass, and the decreased functioning in the central nervous system. So those are the two normal things that happen as we age, typically in our 50s and 60s. And then visual changes in depth perception. So all three of these changes are normal aging changes. But then when something acute happens, like Jane steps off a curb and misjudges the distance because of her changes in depth perception. And because she doesn't have that reaction time, because of the decreased functioning in her central nervous system, and she doesn't have the muscle strength she used to have with the decreased muscle mass, she loses her balance and falls, and she breaks her hip. So this is something that's pretty common as people get older. So these are the three basic scenarios after she's had surgery, after she's gone through physical therapy and rehab. So these are your choices at this point. So this is the best way or the worst way you can deal with this situation. So number one, you can continue exercises on your own properly. So how the physical therapist taught you to do these exercises, and you heal with minor physical limitations, if any physical limitations. Most likely there will be some minor limitations as an older adult. Number two, you can continue the exercises on your own improperly. So examples I gave are just a supported squat and an unsupported squat. You can worsen the problem and end up with arthritis in your knees or a new injury. Or number three, you do not maintain those exercises after your rehab. You have major physical limitations, impairments, and possibly disabilities that it could lead to. So these are just general typical scenarios when somebody has gotten surgery and gone through rehab. Okay, scenario number two. So when normal aging changes interact with a chronic condition. So normal aging changes are loss of taste buds. So Bill increases his salt intake and sugar and fat intake because he can't taste things as well. He has increased his body fat as a result of increasing all of those extras, but he also has hypertension, a chronic condition added to the normal aging changes he's experiencing. So he has a stroke and he goes to the hospital and he ends up with partial paralysis on his right side. This is another fairly typical situation. So let's look at the three possibilities of optimizing this scenario. So number one, continue exercises on his own properly. So proper shoulder range of motion, he goes through the full range of motion, he heals with minor physical limitations, and he continues these exercises. Number two, continues the exercises improperly. So he's not completing the full range of motion. He exacerbates the problem with compensations that create muscle imbalances. So maybe that shoulder is pulled forward more than the other, and he's having to compensate on the other side with his other shoulder and other arm. And number 3, he doesn't maintain the exercises at all. He has major physical limitations, impairments, and possibly in the future disabilities. Okay, third scenario. So this is when those normal aging changes interact with 2 chronic conditions. One chronic condition could be preventable and one maybe not preventable. So the chronic condition that might not be preventable is impairment. So some memory loss, things like that, issues with executive functioning. And then the normal aging changes are the sensory touch or pain sensation decreases. And then osteoporosis, that's something that can be preventable as long as people participate in resistance training, exercise, and keep their bones and muscles strong. So Betty leans on an electric stove, Dr. Rachel preferred to forgetting Jen already turned the stove on and not feeling pain, building a serious burn. So these are the different possible scenarios after something like that happens. So Betty lives by herself, where she has a family caregiver who comes visits every once in a while. But for the most part, she's using her own medications for bone strength, but she's not open because of the burn on her hand. So there's further bone beginning, and then she ends up having a fracture of fall. So maybe she's eating something, she's fracturing her wrists. Another possible scenario, she's unable to drive, so her independence decreases. She's unable to participate in cognitive exercises, say she was going to the community center or eating for lunch and socializing. Her not doing much of that right now anyway, but her cognitive decline worsens in this situation. And then she's unable to talk with friends or family, unable to ask for help if she needs it. So that increases the isolation and the depression that she's feeling. So some of these things that are exacerbated, like the isolation, it could actually add emotional and physical things. So the increased depression and additional injury, things like that. All right, so how does a caregiver optimize these situations? So in these scenarios where they interact and they accumulate through the aging process, which typically starts in our 50s and 60s. So a lot of caregivers are those ages. So if this happens to a caregiver, how can they either optimize it for their own lives if one of these things happen to them, or for the person that they're caring for, if something like this happens to the person they're caring for? Because one or all of these scenarios can cause a downward spiral with permanent life changes. That's what people kind of don't realize. As we get older, it gets more and more difficult to manage these things if they've already spiraled out of control. So again, having that balance between caring for your loved one and caring for yourself. How do you get that balance? In general, taking care of yourself could be taking your medications and going to see your doctor on a regular basis, getting your annual checkup, regular physical activity, eating nutrient-dense foods, your fruits and veggies, fiber-rich foods, and then getting enough sleep. So those are general self-care things that you can kind of monitor. But when something unexpected happens, self-care becomes very specific. And you want to follow the best method for rehab and healing. So those scenarios I went over, like when something unexpected happened, there were very specific things that each of those people could have done to maintain and improve and optimize their health. So at that point, you can actually intervene for that particular issue or limitation. So we have our general self-care, and we have these things that become a lot more specific if something happens. So this is the Nagi Model. This was my favorite model I learned about in my master's gerontology program. So basically, this shows a pathway to disability. And if somebody has a pathology or unhealthy lifestyle or inactivity, it will inevitably lead to disability when we're older if we don't intervene at some point. And the timeline varies. So between each of these arrows, it could be months, it could be years. So the important thing is to figure out where you are on this pathway to the disability and to stop it in its tracks. So either slow it down or stop it from progressing, period. So let's look at arthritis. Arthritis, the first thing that people feel is pain in the knee. In the beginning, it can be very mild. So they've actually found in research that you can do exercises strengthening the muscles around the joint that reduce the pain in your joints. So the knee, the hip, whatever exercises you need to do to strengthen those muscles surrounding the joint, that helps kind of stabilize the joint, and it actually reduces the pain. So if you reduce that pain, you're going to stop that progression from arthritis for a long time, and you're going to have a much better quality of life. The minute that pain gets to a point of a functional limitation, where you're unable to stand up from a chair or you have difficulty walking, that's when that process to the disability can become much faster. So you want to prevent that functional limitation as much as possible. Or once you do get there, look at the other things that you can do in addition to the exercises you've been doing. So sometimes people with arthritis need to lose weight. So you might have to look at your nutrition. You might have to go to a physical therapist to get more specialized exercises to kind of keep that functional limitation at bay and keep it from getting to a disability. Because once it becomes a disability, that's when a disability is what happens where you can't go back, basically. So you end up, you're in a wheelchair or a scooter for mobility. And at that point, when it's a disability, there's no way you can go back anymore. So functional limitation is pretty much the last effort that you can do as far as an intervention to improve that. And typically, once it's a functional limitation, you have to see a physical therapist. It's a little more specialized. And this is just one example, arthritis. I'm going to go through a few more. This is just what I normally do in the class. I pass these out and have everybody fill out their own pathology or lifestyle, like unhealthy lifestyle or inactivity, and kind of look at where they're at in that pathway to the disability. If it's currently an impairment or if it's currently a functional limitation. Okay, so when my mom was still alive, I had created this with all of her conditions at the time. And I got permission from her at the time to kind of spell this out with what she was going through and talk about it in these presentations that I was doing. So remember what I said about things beginning typically in your 40s? That's actually pretty common, and it can affect everything else later on in your life, especially as you age and everything starts to accumulate and interact. So the first thing that she was dealing with that was a huge issue was rheumatoid arthritis in her 40s. It was probably her mid to late 40s. So her limitation was having pain in all of her joints. That eventually became a functional impairment where she had problems walking. So her walking endurance decreased drastically, and she just started gaining more and more weight. So I put obesity as the disability because that really became a limiting factor for her once she started to gain that weight. So then from the rheumatoid arthritis, as she, when when she didn't bring in interventions like specialized exercise or physical therapy that she maintained, once that started, her joints started to become weak and misaligned. So the next thing that happened from that was an acute injury. She tore her meniscus, she had surgery, and as a result of that surgery, she was dealing with deep vein thrombosis. So then, since the obesity became a disability category up here, I brought it back down here to the start of other problems. So that started to lead to things like she got high blood pressure because she wasn't able to exercise as much, high cholesterol. She had some blockage in her arteries, and she ended up having lung embolisms, so blood clots in her arteries and her lungs. And that was in her 50s. She was still young. So then she was still working at the time. Because she started dealing with these issues, these chronic conditions, and trying to manage these things and working full time, she started to have chronic stress. So that emotional part from the physical things that were happening started to come in. So then the stress can also affect the blood pressure. She started having more acute illnesses like flus and colds. She had ear infections. And then she ended up having Bell's palsy, which Bell's palsy paralyzes one side of your face. It's supposed to be temporary. Most of the time it ends up temporary, but for her, it ended up being permanent. So she had permanent facial paralysis. It never went away. And that facial paralysis I brought back down here because that started a new chain reaction of things. So she constantly had dry lips because half of her mouth was paralyzed. She would drool and she would always have to wipe, and she would call her face deformed. She had a great smile. She was always laughing and having fun. She'd always go out. It completely decreased her socialization and also decreased her physical activity. So she decreased fluids, she got depressed. She started dealing with something called hypernatremia, and then she became isolated. So both the physical and the emotional things. And then her mid-60s, her joints continued to just get misaligned. She had the decrepit fingers, so she had difficulty using her hands. Eventually that affected her work. And that's why she retired eventually, because she wasn't able to type anymore. She started to need assistance with chores and meal prep and things like that. And then in her late 60s, hypothyroidism, medication side effects and interactions, fluid imbalance. She ended up having a kidney disorder, and then ended up dying ultimately from hemophilia, a condition that she didn't even know about, that was exacerbated from a surgery that she had had. So when you look at this, it was over the course of 20 years where this decline was gradual, but because of all the things that built up and interacted with each other, it just got more and more difficult to manage, and they all kind of started affecting each other and causing other things to happen. So this is just another worksheet I created. If any of you want to go through each decade and kind of create your own aging map or disability map to see where you're at with certain conditions. So where are we at on time? All right. So quality of life is something that's important when we think about optimum aging and healthy aging and things like that. So quality of life is defined as the standard of health, comfort, happiness experienced by an individual or group. So put simply, how good or bad a person's life is your quality of life. And the purpose of focusing on your quality of life standards, your own personal standards of your own quality of life, you can improve your coping skills. You can accommodate for those aging changes. You can accommodate for the accumulation and interaction of those aging changes along with those acute and those chronic conditions. So let's look at quality of life. This is something I learned in my leisure and aging class, again in my gerontology program. So if you have pen and paper with you, or if you just want to kind of go through this in your head, you want to list 1 through 5. So you actually want to rank each of these things. What is most important to you? Is it your family and friends? Is it your finances? Is it your health? Is it your leisure? Or is it your living environment? So go ahead and do that now. Rank each one, 1 through 5, most important to least important. I mean, they're probably all important, but kind of try to figure out which one is the most important for you. Because that's something that you want to focus on, that you want to improve. And the things that are less important, you want to kind of look at and see why that's not as important to you. Is it not as important because, say you put living environment last, is it not as important because you don't care about it, or because you don't have a great living environment, or because you have a perfect living environment? So things like that. Okay, so the other thing that we want to look at as far as enhancing your quality of life is looking at the different dimensions of wellness. So back in the day, there were 6 dimensions of wellness, 6 general dimensions of wellness: physical, social, emotional, intellectual, spiritual, and vocational or occupational. And as a family caregiver, that would fall into that category, the vocational. And then they've added environmental, which I've added here on some of these models. And then other models, they add things like finances. But I kind of put the finances in the environmental part, or the vocational part. So these are the most important dimensions of wellness. So this is something else we want to kind of think about when we think of our own quality of life and what we want to improve at this time in our lives. So when we set goals, it's good to look at those specific quality of life things that we ranked, and then the wellness, the dimensions of wellness, to figure out how to set more specific goals. So a general example of a physical wellness goal would be to schedule a doctor's appointment, to exercise. Social, visit with a friend, lunch on a Zoom call like this. Emotional, take a break, go to therapy. Intellectual, read or play an instrument. These are things that can improve your brain health. And then spiritual, pray or meditate. And then vocational, volunteer or improve your ability as a family caregiver. Okay. SMART goals: specific, measurable, achievable, relevant, and time-based. So an example of a SMART goal would be, say you wanted to get more healthy. So a way to make it more specific, you would say, okay, I want to walk more, or I want to walk at a faster pace if you're already walking. A way to make it measurable, you want to say a specific amount of time that you're going to walk. I'm going to walk 10 minutes daily. And to make it achievable, if you're not able to do 10 minutes daily, then you modify it so that you can achieve it. So make it so you're walking 10 minutes 3 days a week. And then you want it to be relevant. So you want it to be relevant according to your quality of life standards or your wellness goals. So think about what you ranked for those quality of life measures. What's important to you right now? Your health, your family, your friends, your finances, your environment, your living environment. So think about what's important to you right now and make this goal relevant to whatever you want to focus on. Say your wellness. Then you want time-based. Say, okay, I'm going to do this for a week. Or say you're going to do this for a month. If you're not able to accomplish any of these things you put in your SMART goal and you're a week or two in, then that's when you want to make it achievable. So modify it. Or say, okay, I'm going to switch this to a goal for 1 week so that it is achievable. That's what's good about setting goals following this SMART, the SMART goal process. Okay, so when we go back to look at this scenario, you can look at each of these things, these possible scenarios, and you can figure out SMART goals for each of these things. So that's just why I brought this little slide up again. So let's look at number 1. If she's unable to open her medications and take them, a SMART goal for that would be, okay, how can I maintain my bone strength? Who can help me with my medications? And kind of go through the steps like that. If you're unable to drive, decreased independence, unable to do these cognitive exercises at the other places where you normally went, okay, how can I maintain my intellectual wellness and maintain these cognitive exercises? What are my other options? And you kind of go through the steps like that. Okay, and then so this was just another worksheet for the class for each of you to work on whatever you would want to focus on in your health. So summing up, optimum aging for caregivers, examine your own health status, your own quality of life, what you ranked each of those things, how can you improve your own life satisfaction, which area of wellness would you want to target if you did want to improve something, and then set a SMART goal. You could either do it to make it relevant, you could do it for your own self-care, for your own coping. You could do it to accommodate for whatever aging changes, like say you wrote things out in the Nagi model and you saw like specific things that you could focus on, so you could focus your SMART goal specifically to accommodate for whatever acute or chronic conditions you're dealing with, and then accommodate for whatever accumulation and interaction that might be happening in your life. You want to have that balance in your life as much as possible. A lot of times it's not this perfect balance that's shown in the infograph. It's this one over here with the rocks kind of little pieces squeezed in there to create that balance in your life. All right, so that's the end of this presentation. I'm going to go ahead and unmute everybody. If anybody has any questions or comments. Let's see, we have some questions in the chat box. Okay, just the sound issues. Were you guys able to hear me the rest of the time? Okay.
Majority of the time, yeah, I was. I just want to mention, you know, how great this is. What a great tool you present. This is like being able to create your own personal roadmap or your own personal care plan. You know, it's much more personal than going to a doctor, you know, because it's really just, I don't know. It's great self-care, you know. We're not taught this really. I think, you know, growing up hearing about self-care, I mean, the first things that come to mind are, you know, bubble baths, vacations, and retail shopping. You know, this is a different level and a different approach to self-care that I think is actually effective and can be really helpful. And again, empower us and give us a sense of control, which I don't think a lot of us have. You know, we hear about, you know, self-care, and it's this, we don't really understand what it can be. So I think this is really fleshes it out and illustrates that. So thank you for this.
Yeah. And I've actually worked with people and went step by step with them in the Nagi model and with the SMART goals. And it helps people visualize a lot, like where they're headed with their future, where they are currently. So it actually does work in real life.
On paper, because I've done it like in my head with myself, but on paper, when you're actually visualizing it, it makes a difference.
Yeah, it doesn't make a difference on paper. Like when my mom was going through all of those things, I actually wrote all of them out and showed them to her. And I'm like, Mom, this is what's happening to you. If you don't do something now to like maybe stop this process or stop this one, or, you know, if you manage this one properly. But it was so interesting because I literally witnessed what happened with her before my eyes, where everything quickly accumulated and interacted. And that's a lot of times what happens with families. That's why caregivers, family caregivers, end up becoming caregivers for their loved ones, because these things quickly accumulate and interact, and suddenly these family members or spouses or whoever are put in these positions where they're having to take care of their loved one. Like if my mom had a spouse at the time, it would have been, you know, nonstop. My sister was the one who ended up caring for her and taking to her appointments full time. But yeah, that's what ends up happening with family caregivers. So when I've talked to people about this in the past, that's kind of how I explain it. Like, okay, you've seen what's going to happen, what could happen with you, because you've seen it in your own loved one's life. What can you do in your own life to prevent this from happening to you, so that you don't need a caregiver, so that you don't end up in a long-term care facility? And caregivers especially are able to see that a little more clearly, because they saw, like me, they saw the whole process with their own loved one and the things that they dealt with. All right. So if there aren't any other questions or comments, I don't see anything in the chat.